On this morning's Health Watch, a new warning about ADHD medications and children. An estimated 2.5 million children currently take stimulants like Ritalin. Now, a new study sheds light on the association between sudden cardiac death with some of these types of drugs. Here with more is our very own Dr. Jennifer Ashton. Good morning.
Good morning, Julie.
Tell us more about the study. It sounds terrible.
Well, this is the latest study. It was small, so that is a limitation, but it did show a significant association between teens and children on medication for ADHD and an increased risk of sudden cardiac death. Now, that sounds very frightening, and all parents are always concerned about worst-case scenario. The good news is that sudden cardiac death, while it affects 300,000 people in the country a year, it is a rare event. Only a minority of that number is teenagers. So it's just the latest study and more information really needs to be done.
So what do researchers think is the possible link between taking drugs to treat attention deficit and cardiac arrest?
Well, it's a very important association. All of the class of medication used for ADHD belong to a stimulant class known as amphetamines, and they do have very potent effects on the body. They increase the heart rate, they can increase the blood pressure, and they help with focus and attention in that manner. They can also, in a troubling manner, be used as a drug of abuse, and there is a questionable small but increased risk of sudden cardiac death, and this study is the latest that shows that association.
Are there certain groups of children who are more susceptible to sudden cardiac arrest or sudden cardiac death if they're on these drugs?
It does appear that there are, and the American Heart Association and the American Academy of Pediatrics have published loose guidelines that clearly state that before a child gets placed on these medications, a very targeted history and physical exam should be done. If there's a family history of sudden cardiac death, or if the child has had fainting spells or other cardiac problems, especially in their rhythm or heart rate, then further studies like an EKG really should be done.
So then what are the alternatives? Like, what should parents do that are concerned hearing this morning?
First of all, not stop any medication without speaking to their pediatrician. Ask about whether or not further studies should be done, and they should be monitored with an EKG. And if that's done, it should be read by a pediatric cardiologist, because there can be a wide range of normal. And lastly, there have been studies that shown that alternative or complementary therapies, even like chiropractic care or dietary changes, can be beneficial in some children who are on ADHD medication.
In place of?
Either in place of or in conjunction with. So again, explore your options and weigh the risks versus the benefits.
Dr. Jennifer Ashton, thanks so much.
You bet, Julie.